Hello ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! So in this video I'm going to show you exactly the thought process you should have when you're evaluating a clinical trial. And this could help you if you're completing a journal club or you're interpreting a clinical trial to help manage a patient in real life practice. Now, clinical practice is driven by evidence-based medicine, right? Evidence-based medicine is like the building blocks to clinical practice, and it usually influences the decisions that are made by healthcare providers, so physicians, pharmacists, nurses, etc. So, applying false or weak clinical evidence to a patient may lead to harm. Okay, so being able to develop and also obtain the skill to evaluate a clinical trial effectively is something that every healthcare practitioner should have, and it requires practice. But in this video, I'm going to show you exactly how to do this in just a few minutes. Now, here are the components of a research article, and for each component, I'm going to talk about which kind of questions you should ask yourself and the thought process behind the whole thing. So for the title, you want to make sure the title is free of bias. So for the example here, we have evaluation of overall survival in patients receiving paclitaxel versus docetaxel for stage 4 breast cancer. And for B, we have paclitaxel is more effective than docetaxel for stage 4 cancer. Now, as you can see in option B, they're clearly telling you which medication is effective in the trial, right? They're basically telling you the result. And that is not the right way to do this. You must let the findings speak for itself. You must let the evaluator or the reader go in, read the trial, and determine the results on their own. Next, the title must clearly communicate exactly what the study is going to be about. So once again, if you look at example A, they clearly tell you that they're going to be evaluating overall survival in patients that are receiving these two medications for stage 4 breast cancer. It's pretty straightforward. For the authors, you want to make sure that there is no conflict of interest. Well, there could be conflict of interest, but they must disclose it, right? So whether there's conflict of interest or not, it must be disclosed in the article. And if there is some kind of conflict of interest where, let's say, the author is receiving grants from the company that makes the medication that the author is publishing about, then you definitely want to take the results with a grain of salt. Now, what are the author's field of specialty? This is something you want to take into consideration also. We prefer that the authors who are publishing this study are like practicing in the scope, right? In their own scope, this publication is related to their scope of practice. So example here, a cardiologist publishing a paper on the toxicity associated with two medications for skin infections compared to a pulmonologist publishing a paper on the effect of gasoline on the lungs. Right, so obviously B is publishing a paper in your scope, and I'm more confident when I'm reading that trial. For the introduction, did the researchers evaluate previous trials? So usually the researchers will include previous trials that evaluated that same research question. And they may say, okay, there were previous trials, but it wasn't conducted well. So this is the reason why we are conducting this trial, to be able to evaluate this research question and, gain more information about this. Also, the introduction should usually include these four things, right? The patients that are in the trial, the intervention that are given to the patients, the control group and what they received, and the primary outcome. Now, if a trial doesn't have this in the introduction, it doesn't necessarily mean that the trial was poorly designed, but usually a well-designed trial or research paper should have this in the introduction. So next, in clinical literature, is it the first time this research question or topic has been evaluated? If this is the first time this research question has been evaluated, and let's say they come up and say that, okay, there was some kind of benefit, you definitely want to be careful as to how you take the results and apply it into real life. Remember, no other researchers have evaluated this question yet. So you probably don't want to just start applying the results right away. You probably want to wait till more evidence or more data comes out after the trial is completed. Are these patients going to end up experiencing some kind of harm, months or years after the trial is completed? We don't know. But you usually want to wait, or you usually want to wait till like a well-known organization is, recommending the use of, a specific medication based on the trial, or they just make a recommendation based on the results of the trial. So with that, you could feel more confident as to applying these results to your patient, even if it's the first time that research question was evaluated. Now, for the methods section, you want to know who was included in this trial, right? Obviously, that's very important. If the trial is clearly saying they're studying patients with stage 4 breast cancer, then the trial must include patients with stage 4 breast cancer, right? They can't just include only 25% or 50% of the patients being 50% of the patients having stage 4 breast cancer, right? That's not going to be very accurate. You also want to look at who was excluded from the trial. So normally trials tend to exclude a lot of patients. They may exclude patients with, different comorbidities, patients who may be hard to follow up with, and in real life clinical practice, we deal with these patients, right? We deal with patients who are non-compliant. We deal with patients who have other comorbidities. So if the trial's excluding that, then it makes it very hard to, apply the results of the trial to our patient. Next, you want to evaluate the different arms of the study, right? So there's a placebo control, which is usually the stronger one that we tend to see in trials, right? Where they're comparing an active medication to a placebo. And that allows us to, really know that the results or the effect of the medication was mainly due to the active medication. They may also have an active control where it is not ethical, right, to give a patient a placebo. So they may compare two medications, two active controls to determine which one is more effective also. Or a double dummy may also be um, used where, let's say you comparing two active medications, right? But one is injectable, one is oral. Obviously, that could lead to some kind of bias, right? So if a patient is getting one injectable, or the investigators, they know that one is getting injectable, one is getting oral, it automatically we may think that the one getting the injectable may respond better because the medication is going to reach the bloodstream faster, or whatever the case is. So they do a double dummy where they want to balance this out. So the group that's getting the injectable will also get a placebo oral, and the group that's getting the active oral will also get a placebo injectable. Next was the trial randomized. And this makes the trial obviously stronger, right? There's randomization, there's no bias in the patients that were selected, which could lead to like, a fair comparison between the groups of the trial. Was the trial blinded? And if it was it single or double blinded? Blinding of a trial is also very important. So if you're evaluating a trial and it wasn't blinded, you want to be careful as to, applying the results to your patients also. And usually if the trial is unblinded where the investigators don't know what medications the patient got and the patients don't know what medications they have, then that's the stronger version, right? But if it's unblinded where they both know what's going on, right? So the patients know what medication they got, the investigators also know what the patients received, then we wouldn't want the endpoints to be subjective, right? We want it to be objective where let's say we're using like an imaging test to determine the effect of the medications that the patients got. We wouldn't allow the patients to be the one reporting the results or even the investigators, as this could lead to some kind of bias. You also want to look at the sample size, and the sample size is usually related. It's always related to the power of the study. Now, the power is the probability of a research detecting a difference between the intervention and control group if there is a true difference. Now, the goal power is usually 80%, and this simply means that if there is a true difference, this research has an 80% chance of detecting it. So you always want to make sure that the study meets power. So they usually put this in very clear terms that, okay, we need 500 patients total in this trial to, have a power of 80% or 85%. Once they meet the power, it means they had enough patients in each group to find a true difference if there was actually a difference that existed in the trial. Now, the endpoints could be objective or subjective also, but like I said earlier, if the trial is unblinded, then the endpoints should be objective. So keep that in mind. The endpoints could also be primary or secondary. The primary endpoint is the reason why they designed the trial. It's the endpoint that the statistical analyses were calculated for. So you want to make sure that that's also, clearly stated in the trial. Secondary endpoints are, a little bit less important, but usually they include that just to see if there's any other thing that they might be missing, or just to just assess if the, let's say, active versus placebo, if the active may cause other effects or lead to other results that they weren't, initially focused on. And this could lead to, other research questions or research hypotheses for the future. Then they have composite endpoints. Now, a composite endpoint is when one endpoint is composed of multiple endpoints, such as cardiovascular death, myocardial infarction, stroke, and hospitalization. So, usually, researchers will use this method when they can't find a statistically significant result with just say one endpoint by itself. So what they do is that they combine multiple endpoints, and that usually helps the results become statistically significant. And if a study is using this method, you want to be careful, right? So you can't just automatically assume that these patients had lower risk of hospitalization when the whole endpoint was actually a composite endpoint. You have to look at hospitalization by itself, and majority of the time, the individual endpoints and the composite endpoints, a lot of them are not statistically significant. Surrogate endpoints are also used, and sometimes researchers use this, and even if they do find some kind of statistically significant result, is it really clinically important? So let's say you're looking at active medication versus placebo to see the reduction in LDL. Now the LDL number may reduce, right? It may go down, but how does that translate into the patient's overall health, right? Is the patient going to be more functional? Is the patient going to have lower risk of heart disease? Is the patient going to live longer? So we don't know, right? So surrogate endpoints are usually not that effective when you want to talk about, the clinical impact. So let's say a trial is evaluating the overall survival, right? So the number of people who died, right? Compared to placebo or whatever the case is, after receiving this medication, that one is more clinically significant. So the methods also include the statistical analyses, and they usually tell you exactly how they are going to conduct the statistical analyses. And I'm going to include a link in the description for you guys. I have a video that, focuses mainly on statistical analyses. I discuss the p-values, the beta, type 1, type 2 errors, etc. So make sure you check out that video. Next, are the results based on the intent to treat, where all patients are randomized to the treatment group? The modified intent to treat, where they may say, okay, all patients are randomized to the treatment group plus one more criteria, right? And the criteria could be, okay, all patients who are randomized and completed 3 months of study, all patients who are randomized and received, five medications, right? They receive at least five doses of the active medication, right? So it's always all the patients who are randomized plus one more specified criteria. Then we have per protocol, which is patients who are randomized and also completed a trial. Now, a strong trial is usually the one that utilize the intent to treat population in the results. So they include all patients that were randomized in the trial. And this is very important because if you compare it to the per protocol, where they only include patients who completed a trial. So let's say the trial is 3 years long, right? A lot of patients may have dropped out, right? So in this case, for per protocol, they didn't include these patients. But in the intent to treat population, we actually, that's more related to what we see in clinical practice, right? We may have non-compliant patients, patients who will stop taking the medications, compared to the per protocol where these patients were actually complying, adhering to the medications. They did everything that the trial wanted them to do until they completed the trial. Right, so these are like perfect patients compared to the intent to treat, where you could have good or bad patients when you initially randomize them. But the per protocol is also very important when you want to evaluate the safety of the patients who are included in the trial, right? So we look, if it included all the patients who actually completed the trial, then we could go back and say, okay, so who didn't actually complete the trial and why did they drop out? For the results, you want to compare the baseline characteristics, right? You want to make sure that one group is not, more healthier compared to the other group, as this could lead to some kind of, bias, or is definitely going to affect the results. So you want to make sure that the baseline characteristics have no difference. So sometimes they may include like a p-value also. So in this case, you want to make sure that the p-value is not significant in terms of the comparison between the groups in the trial. So no difference between the two groups that were in the trial in terms of like baseline characteristics. Now, are the results statistically significant or clinically significant? Right. So once again, a trial could find that this number of patients had a reduction in the blood pressure, right? But is that really going to translate to patients living longer, right? Or a trial can also find some kind of result, but is it clinically significant? Is it really going to impact what we do in clinical practice? Is it going to lead to any changes? Is it going to cause this new medications that you're studying about to become the first line agent? Okay, so you want to think about all of these. Yes, the p-value was significant, right? But what's going to be the outcome in clinical practice? You also want to assess the safety data. Is there a difference between the study groups? Is there a reason why one group had more patients drop out compared to the group? And also, was the trial stopped early, right? That's very important. A trial could stop early due to several things. One being that there was a lot of toxicity associated with the active medications, or it could be that the active medication was showing a lot of benefit, so that's why they stopped it early. So if they mention that they stopped the trial early, you just want to know why did they do that. So for the conclusion and discussion, so is the conclusion representative of the results, right? And this is pretty straightforward, right? They said according to the results section, there was a decrease in, overall survival in the placebo group, and it was statistically significant. Make sure that the conclusion is also, saying that basically. So just make sure it matches. The internal validity, this has to do with any bias or confounding in the trial itself. So it really focuses on how well the trial was designed. And this may be present when the study result represents the truth about the sample population. Okay. And this is achieved when it's a well designed research, so it has randomization, double blinding, has the appropriate control, etc. Okay, so internal validity is basically saying how well was the trial designed. Then we have external validity that's saying, okay, this trial, let's say the trial had really good internal validity, right? It was well designed. The results are really representative of the sample population, but can we actually generalize and apply these results to the whole population, right? And that's usually impacted by the exclusion criteria. So if the trial excluded all the really sick patients and and then they come up with a really significant result, can we actually apply this to the general population? Maybe not. And also, what were the limitations of the research? And every research usually has a limitation, and that's something that the research must also include. And that would be the end of this video. I hope I didn't go through it too fast, but I definitely wanted to show you guys that you could evaluate a clinical trial in a matter of a few minutes. But in order to make this skill more effective, you must practice a lot. But if you have any questions, feel free to drop it in the comments, or just send me an email, whatever the case is. If there's something you didn't understand, just let me know. I'm gonna include the link of the videos of the statistical analyses down in the description, so make sure you check it out. Until then, I'll see you guys later. If this video was helpful, make sure to like, subscribe, share, comment, and just share it with somebody who may benefit from this video. And until then, I'll see you guys later. Take care.